This is your medical health feature with Dr. N. Williams on the WeakLink Digital Audio Magazine.
Good day, I am Dr. N. Williams. I am a qualified medical doctor. I did my undergraduate at the University of Stellenbosch, and I'm currently a medical officer in a very busy emergency center in the Greater Cape Town region. So pain from the lungs are more related to if it's worse when you cough or if you take a deep breath in. If it's associated with things like fever, flu-like symptoms, in the COVID times, it is a bit more challenging, because COVID can give you chest pain, making it feel like it's coming from the heart, but also it can be chest pain, making it feel like it's coming from the lungs. But that again is for us to figure out. So if it's something like heartburn, so most people with heartburn will either tell you, no doctor, it's not the same as my other heartburn pain. Then you have to take note, because everyone knows how they perceive their pain. If you're a patient that says, no, the heart pain is always like that, I'm going to be, it could still be heart related, but I'm going to be a little bit more at rest, knowing that it's still the same pain that you've always had, and there's not been a change in your perceived pain. But again, it's very difficult sometimes. Sometimes what is perceived as heartburn could actually be coming from the heart, because if you look at the heart, or if you have a mental picture of the heart, the bottom part of the heart is very closely related, or in a very close relationship to your diaphragm, which is on top of where your stomach is. So what's perceived as heartburn, meaning in your upper abdominal area, just below your rib cage, can be felt as if it's stomach pain, but it's actually cardiac chest pain. So for pain that is anxiety related, it's normally perceived by some kind of stressor, something that is causing a lot of anxiety and concern for the patient. And that is pain that can be relieved by, just listening to the patient. Long term, it's something that people that needs a bit of coping skills on how they need to work with anxiety. Some people do need a little bit of medical help, some kind of medication, but that is for your medical practitioner to decide. So we as medical doctors have the work to diagnose. You, the patient, come with a complaint. We ask you a little bit more about the complaint and we diagnose it. We will ask for things such as ECGs, which is a little trace of cardiac activity. It's like a special investigation that we can easily get done, as we call in the front room. If it helps, we will do a X-ray if it is indicated, to help us differentiate between more life-threatening and cardiac chest pain, or non-cardiac chest pain. There are things that will make us also more concerned. Patients' sex, age, and associated risk factors. So there's people that are hypertensive, obese, diabetic, smoker, family history of cardiac diseases, high cholesterol. So those are all risk factors that makes your chance of having a heart attack that much bigger. After all of that, in collaboration with our investigation, we will be able to tell you, we think it's most likely cardiac, or it's most likely not. Sometimes it is a little bit more challenging, and that's also where special investigations such as blood tests can also be of great value. So just with regards to chest pain, what must you look out for? I would say if you are concerned, please do seek medical help. We do see a lot of young people coming in with chest pain, and most of the time it's not cardiac related. But for every few young people, you do see the occasional 30 plus year old that does have a heart attack. So we would rather tell you that, it's fine, you live, it's not a heart attack, it's not anything detrimental, and send you home, then you're not seeking any medical advice, and then you actually die from it. Or you are a 30-year-old, but you have 50% of your cardiac muscle that's still working. Your life expectancy, you should live a lot more years, but obviously that does affect your quality of life when you have your heart working at half or even a fraction of the capacity that it should be working at. We want everyone to be, at their best level of function.